I'm a nurse by background, an intensive care nurse by background, and spent many years in clinical practice before going into nurse management. And I've always been driven by quality and patient safety, and I guess my patient safety journey started in my time in Nottingham, where I was the Director of Nursing at Queen's Medical Centre, and we had the really sad situation where one of our patients was given intrathecal vincristine, and that was the Wayne Jowett case, and I was obviously very heavily involved in both the investigation that we did internally, but also in the care of and support of Wayne's family after the incident. And for me, that really started resonating as a situation where all of our staff were doing what they did with all good intentions, but you could have driven a carriage and horses through the potential for all of the things to go wrong that did go wrong. And so that for me started me on this journey that really focused particularly on the importance of human factors and the fact that things will go wrong when you're in an organisation that relies heavily on the interaction between human beings. Following that, I was given the opportunity to be a non-executive director on the board of the first quality regulator, the Commission for Health Improvement. And again, that built on that experience that I had. And that to me demonstrated the important role of the board in terms of monitoring, supporting, developing quality and patient safety, and that very important focus of the board. I became a chief executive towards the end of my career, and I'd like to think that the values that were very strongly within me as a nurse, that I was able to use those values as a chief executive, and that took me up until the point that I took early retirement. And then it was following that I was asked to go into Mid Staffs when they got into trouble. It was probably the toughest job that I've done in my entire career. I mean, I've been in the NHS since starting as a cadet nurse at the age of 16. And so it's a very, very long time. I'm very loyal to the NHS. And I think one of the things that immediately hit me when I went to Stafford was to see firsthand the impact that it had on all of those patients and families, and where the NHS had let them down badly. And the result of that was that there was a total loss of confidence, not just in Mid Staffs, but in the whole of the NHS. So we recognised as a new board that our role was going to be very clearly to rebuild public confidence, and the only way that we were going to be able to do that was to do a number of things. Firstly, to reduce the amount of harm that was still happening, and secondly, to create a body of patient safety approaches and culture that would actually enable our staff to refocus on what really mattered to people and the people of Stafford. And we were getting some very strong messages that they felt the trust had lost focus of what really mattered, and that our biggest job was to refocus the whole of the trust in terms of seeing that what was important was keeping patients safe and getting ourselves onto this journey of continuous improvement and putting in place sustainable systems and processes to enable us to do that, and wrapping around that a culture of continual quality improvement. Well, I think one of the things that surprised many people was, before I went there, I'd heard that the trust was in trouble. And I think there was a view out in the public that everybody in Mid Staffs was bad and everything that they did was bad. And one of the biggest surprises that I had when I went there was that, of course, that wasn't the case. I've seen some of the best clinical practice, and I've seen some of the best clinical practitioners that I've seen in my career during that 3 years that I spent at Mid Staffs. And I think one of the biggest surprises that I still have, because I still think there's a long way to go, is this huge variation in terms of the quality of clinical care. Sometimes it was even within the same ward, depending who was on duty. Often it would be between two wards that were next door to each other. And sometimes it would be between the different hospitals in the trust. And I think as an NHS, we've still got a long way to go in terms of reducing the variations in standards. Well, I think it's very difficult, and Robert Francis pulled this out of his report, because clearly one of the things that he was under pressure to come up with was who's to blame for all of this that went wrong. Well, of course, there wasn't one profession or one individual or one part of the organisation that was to blame for what went wrong. For me, the three things that came together that should have happened, and had they happened, then maybe the scale of the failings at Mid Staffs wouldn't be in the way that as bad as they were, was firstly the professionalism of the frontline clinical teams. And it's the reason that we're here as a board or as leaders is to support our colleagues on the front line to deliver safe, effective, compassionate care to patients. As health professionals, as a nurse, I know that the reason I'm different is that I've gone through an education programme to train me to a set of national standards. I've worked within a system where there's a set of behaviours that I would be expected to deliver. And I know that there's a set of practical skills and competencies that I've been prepared to deliver. If for whatever reason they fail, then we're on the slippery slope. Secondly, I think there is a responsibility on boards to provide the organisation with effective leadership, with the sort of values that support the delivery of high quality, compassionate care, that enable people to flourish, that listen to people when things go wrong, and that listen to people when they say that practice isn't what it should be. And thirdly, yes, there is a responsibility of a board to set in place the systems and processes to monitor the standard of care that's being delivered to its patients, and to set that culture and the values that it expects its staff to deliver. So in other words, one of the important messages for me at Mid Staffs is, as soon as we started to role model the behaviours that we expected other people to work to, we began to see a turnaround in the organisational culture. The people that inspire me are the people that work on the front line of healthcare. I got myself into trouble a few years ago by saying to our local newspaper that although I'm a nurse, in no way would I be able to cope now with what my colleagues on the front line cope with. I have never seen pressures on the service like we see today. I see good people day in, day out, trying their best to deliver good quality care, sometimes in spite of the system, not because of the system. And I see my mission to try and change that system so that our colleagues on the front line can more often say that the system is helping me, not obstructing me. I think probably one of the most important things that I'd like to see change happen as quickly as possible is in terms of the cultural issues and the context in which our colleagues on the front line are trying to deliver care in. So in other words, I would like to see them saying that they felt valued, that they felt supported, that they felt adequately resourced, that they felt developed and trained to do the job that we expect them to do, and that they felt that their leaders and their managers were aware of what it feels like to be on the front line. And I'd like to think that they felt that they were able to speak out openly and honestly without fear of retribution when they have concerns about the quality of patient care or the behaviours that they see being demonstrated to patients. And I'd like to see a culture where patients really felt true partners with the health professions, and that we worked much more closely with them in terms of the way healthcare is planned and developed and delivered in the future. I have learned from my experience at Mid Staffs that the closer you work in partnership with those that you serve, the better the outcome will be for everybody concerned. Well, what I'd get rid of is what I spoke about earlier, is I'd remove these huge variations, and I'd want to bring everybody up to the standard of the best. If we did that simple thing, or what is apparently a simple thing, I think we'd be making huge improvements in both quality and safety, and getting into the culture of an organisation, that what's important is not just to learn from when things go wrong, but let's learn from why things go well, and let's then design our systems and processes from that rather than what goes wrong. What I'd add is probably a magic wand that says that everybody that spoke out would be treated fairly, would not be discriminated against, would be thanked for speaking out, and would be assured that the story that they told would be used to make things better for patients in the future. And what would I want to add that doesn't exist at the moment? It would probably be a recognition on the part of every single board in this country that the reason that they're there is to support the people that work on the front line, and that if we get it right for them, we'll get it right for the patients as well.